This year, an estimated 1.7 million individuals in the United States will be diagnosed with some form of cancer. And for our next guest, Matt, it was a rare cancer that caused his blood to literally thicken. Well, we sat down with Matt and his doctor to learn more.
My name is Matt. I'm 55 years old, and in 2005, a doctor raised concern over my blood work during prep for a surgery. Over the next 2 months, while I recovered from the surgery, I suffered at least 2 heart attacks, and I was referred to a hematologist. In late 2005, I was given a bone marrow test, which came back positive for a rare type of cancer that I'd never heard of. I was diagnosed with Polycythemia vera, or PV, a rare blood cancer.
Matt joins us today along with his physician, Dr. Ellen Ritchie from Weill Cornell Medicine at New York Presbyterian Hospital. So good to have both of you. And Dr. Ritchie, I want you to explain or tell us a little more about this cancer.
Matt has PV, which is a rare blood cancer categorized as a myeloproliferative neoplasm. And these are disorders where the bone marrow functions abnormally.
And the bone marrow is where the body's blood cells are made. So, Dr. Ritchie, in that vein, can you explain who may be at risk for this?
MPNs affect approximately 200,000 people in the United States. It's a rare blood cancer. The risk factor for developing these diseases is actually specific gene mutations that you may develop over time that make you vulnerable to the disease. The disease generally affects patients over the age of 60, but people of any age can be affected.
When you do have PV, the body overproduces blood cells, causing the blood to thicken. Thickening can lead to blood clots. That can, of course, block blood flow through arteries and veins. And I'm going to ask you, Dr. Ritchie, because you are Matt's doctor, is this what happened to Matt?
So Matt had a particular complication early on in his diagnosis. He had a heart attack. You can also have a stroke. So cardiovascular disease is a real risk factor of having polycythemia vera. Other risks to having this disease are really mainly blood clots and cardiovascular complications. So we're very careful when we manage patients to manage the disease itself as well as cardiovascular risk factors. Over time, patients can develop symptoms also which advance, and part of good medical care is controlling these symptoms.
Symptoms may include fatigue, concentration problems, feeling full after eating small amounts, itching, stomach pain, and night sweats. Matt, I'm curious, did you experience any symptoms?
Yes, I did. I experienced red complexion, bleeding gums, and some of the symptoms I experienced long before I was diagnosed.
Dr. Ritchie, what else do people need to know about this type of cancer?
Like Matt, most patients have never even heard of myeloproliferative neoplasms or polycythemia vera. They're rare blood cancers. So this is a chronic disease. It's a blood cancer, but it's followed basically over years and decades. However, there can be serious outcomes to having the disease, and over time it can advance to a more serious form.
So Matt, obviously you've been through a lot. What advice do you have for those who are affected?
Well, I think it's really important that a patient seek out a MPN expert, and it's also very important that they empower themselves with information about the disease.
I love that concept. So I want to ask you how you go about empowering yourself.
Sure, what I do is keep records of my blood counts. I also keep a track of my symptoms and procedures. I participate in support groups, and I take the information that I learn there and the tips and suggestions back to my physician, Dr. Ritchie.
And so getting back to patients who have this, are there guidelines out there?
The National Comprehensive Cancer Network has a set of patient guidelines which give information about the disease itself, about symptoms of the disease, about how the disease is diagnosed, and how the disease and symptoms are managed. You can access these guidelines at a particular website, nccn.org/patients/MPNs. There are other good sources for patient information, including another website, voicesofmpn.com.
And Matt, I'll ask you, have these guidelines helped in your scenario?
Yeah, unfortunately, MPNs really are a very misunderstood disease. So the guidelines have really been a resource for me to become more informed about my disease and have better conversations with my physician.
Thank you both so much for being here today. Matt, I wish you the best of luck in the future. Dr. Ordon, back to you, my friend.
Stay tuned, lots more to come.